Here, a pregnant client tells the clinic nurse that the wants to know about the sex of her baby as soon as it can be determined. So parents are interested to know what are the sex, right? Sex, gender, and sex identification is different. Anyway, the sex actually by born, right? Male or female. So I said the parents is interested to know their coming baby will boy or girl, and what are the appropriate time to check it. So the nurse informed the client that she should be able to find out the sex at 12 weeks of gestation because of what factor. So definitely we are going to learn a factor responsible for determine the sex. But in this question, we learn one more thing. During the 12 weeks of gestation, a parents can go for test to find out the sex of the coming baby, right? But in this question, examiner asking you that, what are the factors related to this? There are four options. The appearance of fetal external genitalia, then beginning of differentiation is fetal groin, and fetal testes are descent into the scrotal sac, or internal difference in male and female become appear. So basically, at the end of 12 weeks, the external genitalia develop or start to develop, basically. So appearance of the fetal external genitalia, because the mentioning the time here, right, at the 12 months. So what rationale? By the end of 12 weeks, the external genitalia of the fetus have developed to such a degree that sex of the fetus can be determined. And this one determined visually even. So I said we can do some investigation like ultrasound, Doppler studies. We can find out what is the baby's male or female, right? So differentiation of the external genitalia occur at the end of 9th week. So differentiation of external genitalia occurs, and testis descend into the scrotal sac at the end of 38 weeks. So testis develop in intra-abdominal, but it go down, descend to the scrotum, right? During the, here mentioned 38 weeks. But around the 12 weeks, development of the external genitalia start. So our best choice is the number one. So question here, next question here, they said a nurse is performing assessment on a client who is at 38 weeks gestation and noted that the fetal heart rate 174 beat per minute, right? So keep in mind, the nurse performed assessment of the client 38 weeks, still baby inside, not a infant, not a newborn. So note that fetal heart rate is 174, right? 174. So on the basis of this finding, what is the priority of nursing? So definitely 74 is not normal. So document the findings, check the mother's heart rate, notify the healthcare provider, tell the client that the fetal heart rate is normal. Definitely, you know that number 2 and 4 not an answer. Number 1 is a good option, but it is our responsibility to do something, go for the action first, then keep documentation. So notify the healthcare provider first, then you check or you keep the documentation. So your choice should be notify first, right? So the rationale saying fetal heart rate depends on gestational age and range from 160 to 170 beat per minute in the first trimester, but slowing with the fetal growth 110 to 160 per minute near at the term, means around 38 to 40 weeks. It is mentioning 38 weeks, 74 is not normal. So heart rate, if the heart rate less than 110 or more than 160, both are abnormal, right? We could notify healthcare provider. That's it. So I said, don't forget the fetal heart rate here from here. So next question, say the nurse is conducting a prenatal class on female reproductive system. When a client in the class asking why the fertilization ova stay in the fallopian tube for 3 days, what are the nurse best response? So we know the fertilization occur in ampulla, stay the fallopian tube. After certain time, the fertilized ova or zygote come in uterus for implantation. The question is here why it should stay there for a time being, right? Why? So it promote the fertilized ova's change, there's chance of survival. It promote the fertilized ova exposed to estrogen or progesterone. This is not a nothing, actually literature do not agree with it. The promote the fertilized ova normal implantation in the top portion of uterus, and also it promote the fertilized ova exposed to luteinizing hormone. Literature never agree with it. So I said these number 2 and number 4 not a true. Number 1 and 3, it promote the fertilized ova's chance of survive. It promote the fertilized ovum normal implantation in the top portion of uterus. So basically 1 and 3 we prefer because this is the continued process, and here we know the implantation occur in the top portion of the wall of the uterus. Implantation top portion, it is promote the fertilized ova. So definitely number 3 should be the answer. So let me read their rationale. tubal isthmus remain contracted until 3 days after conception to allow the fertilized ova to develop within the tube. This initial growth of fertilized ovum promote its normal implantation in the functional portion of uterine corpus. So definitely we found the answer in this explanation, right? What else? Estrogen is a hormone produced by ovarian follicles and corpus luteum, adrenal cortex, placental during and also placenta during the pregnancy. Progesterone is a hormone secreted by corpus luteum. So whatever our answer is here, develop within the tube and also initial growth, fertilized ova promote the normal implantation, right? So another question is here is select all categories. So what it is, they said the nursing instructor asks a nursing student to explain the characteristics of amniotic fluid. So amniotic fluid, which is covered the fetus in the sac. The student responds orally by explaining which of the characteristics of amniotic fluid, right? Select all. So now here the student responds correctly. So about the amniotic fluid, which information is correct and which is not a correct, right? So what are the function of the amniotic fluid? What are the content of the amniotic fluid? And what are the diagnostic purpose of amniotic? It is the basic information we could know that. But here I said question most probably talking about the function of amniotic fluid. What is your choice? Allow for the fetal movement. It is true because the fluid, because of the fluid, the baby can movement. It is true. Surrounding caution and also protect your baby. Yes. Maintain the body temperature. Body temperature definitely maintain it. Can used to measure the fetal kidney function, can protect the kidney function. So if you want to see your baby's kidney is functioning or not, if you collect the amniotic fluid and check the creatinine and BUN, it reflects the fetus kidney function as well. So it is the choice as well, right? Prevent the large particles such as bacteria from passing to the fetus, preventing large particles. It is not true. Literature do not agree with it. Prevent the large. They do not prevent. Provide exchange of nutrient. Never. Umbilical cord do this, right? So it is not a choice. So it is this question talking about the function of amniotic fluid. What is the function? Amniotic fluid surrounding caution and also protect your fetus. Allow the fetus to movement, maintain body temperature, right? And also amniotic fluid contain urea from fetus and can use to check fetal kidney function. That's it. So next question here, they said most appropriate. I read the last sentence so easily to understand what it is. They said a couple comes to the family planning. So family planning clinic and asks about sterilization procedure. So which question by the nurse should determine whether this method of family planning would be the most appropriate, right? So definitely we ask some question about the couple. I mean, how many babies you have, then we can decide what we should do. So the first one, did you ever had surgery? One question. Second question, do you plan to have any other children? Or how many children you have all before, or do you have a chance to take another baby? Do either you have diabetes, or do either you have a problem with eye? So any this question you can ask about their past medical history, their present medical condition, but which was the most appropriate about the contraceptive method? Number two, makes sense. Do you have a plan to have any other children? So this is our choice. Rationale, the sterilization is a method of contraception, right? So it should be considered permanent end of fertility because of uh, reversal surgeries not allowing successfully. So a couple comes to the family planning clinic, asks about the sterilization. So sterilization process, it is not a contraceptive like OCP, oral contraceptive pill, not like it, the surgical permanent procedure. If they do not have any baby, or if they have a plan to take more baby, it is the question come, right? So next question here, so showing a nurse should make which statement to the pregnant client found to have a gynecoid pelvis. So there are several type of pelvis, right? Several types of. So gynecoid pelvis is one, and it's a normal, basically gynecoid pelvis, they said, right? So number one, they said U type of pelvis has a narrow pubic arch. So I said there's several type of pelvis, but the normal one is called gynecoid pelvis, the normal one. Hmm? So U type of pelvis has a narrow. No, it is not true. It is wide. U type of pelvis is the most favorable for labor and birth because gynecoid pelvis is wider, more space. Okay, it is not a narrow. It is like the female type, not a man type. So that this type of pelvis is a wide pelvis, but it is a short diameter. Definitely no, it is wide and it is favorable for deliveries. So your choice should be two. And number four said you will need a C-section. Definitely no, if there are no medical condition. So it is that I said gynecoid pelvis are the normal pattern. So they said the normal female pelvis and the most favorable for successful labor and birth. And it is easy or facilitate for normal vaginal delivery. In that case, we do not need for any kind of cesarean section. So next question here, which purpose of placental function should the nurse include in a prenatal classes? Hmm? Which purposes of placental functioning should the nurse include in a prenatal classes? Select all here again. So Now see here one, what are the normal function of placenta? Actually, this question asking this. It cushions or protect your baby. Definitely amniotic fluid do this. Previous question we found, this is not a choice. It maintain no amniotic fluid maintain the temperature. It is the way baby get food and oxygen. It is the answer. One of the good choice. It is placenta. It provide all antibody, all, definitely not all, it is not a choice. And it provide an exchange of nutrient waste product between mother and fetus. It is very good choice. So we should babies get food and oxygen and exchange the nutrient and waste product to the mothers too and baby. So rationale. Placenta provide a exchange of oxygen, nutrient, and also the waste product between the mother and the fetus. Amniotic fluids surround and also protect the fetus and maintain the body temperature. So next question here, what they said the nurse is providing instruction to the pregnant client who is scheduled for an amniocentrisis, and what instruction should the nurse provide? Amniocentrisis. So amniocentrisis is a procedure we do it to check some congenital defect in the baby. But before to test, we need to permission, consent, because this is there's some risk factor as well. So this is schedule, which instruction should the nurse provide? Number one, they said strict bed rest is required after the procedure. It is not true. Strict bed rest, no. Hospitalization is necessary for 24 hours after procedure. If any emergency not arise, patient do not need to stay in hospital 24 hours. And informed consent, definitely it is the invasive procedure, definitely need to the informed consent. A fever is expected after procedure because of trauma to the abdomen. Absolutely, it is not true always if there are no complication arise. So number three, we think is the best option. So now here's rationale. They said because amniocentrisis is an invasive procedure, informed consent need to obtain before procedure. After procedure, the client is instructed to rest but may resume a light activity after the cramping subside. So a pregnant client in the first trimester called the nurse at a healthcare clinic and also report that she has noticed a thin, colorless vaginal discharge. The nurse should make which statement by the client? So this question, keep in mind, you have to exclude for menstruation or period, amenorrhea or stoppage of menstruation, the first sign of pregnancy. And definitely, according to the explanation of the pregnant mother, she said it is thin, colorless, vaginal discharge. Definitely, it is not a menstruation blood look like, according to her statement. So, nurse should make which statement to the client? So, a RN should tell what is normal and what is not normal, educate them so they will not be panic. So what is normal, you could explain them. So they said, come to the clinic immediately. One, vaginal discharge may be the bothersome but a normal occurrence. It is not true all the mother have to this problem, but some of them have it, and it's a normal, right? Report emergency department not no way, and use the tempton if the discharge is bothersome, but be sure to change the tempton every 2 hours. So vaginal discharge may be bother, but is a normally it can occur, right? So here we educate our patient what is the normal findings during the pregnancies. So it's called leukorrhea. Leukorrhea begin during the first trimester. Make client notice a thin, colorless, and yellow vaginal discharge throughout the pregnancy. And some client become distressed about this condition. But you are there, you could educate your patient. This leukorrhea is a normal, but leukorrhea is supposed to be thin, colorless vaginal discharge, right? So the next question they said, a non-traced test. So in my recording class in YouTube channel, you can get it. What is non-traced test? What is contraction test? What is fun test? Everything is there. So a non-traced test is performed on a client who is pregnant. The result of the test indicate non-reactive findings. Non-reactive findings. The health care provider prescribe a contraction traced test. So first of all, non-traced test, then prescribe for contraction traced test, and result are documented as negative. How should the nurse document in these findings? So there are two tests, my friend. First of all, non-trace test. Then doctor prescribed another test called contraction test. Right? So what are the interpretation we have to know? So negative is good or positive is good. So always it is important to know the contraction trace test or interpretation. Negative means normal. And if the contraction test positive, it means something wrong. So I said now, which should the nurse document these findings? But already showing the prescription contraction trace test and the result document negative. As I told you, contraction test negative means this is normal findings. Okay. So normal test result, abnormal test no, high risk no, need for the no. It is the answer. We choose it. So rational said the contraction trace test result may be interpreted as negative, and positive should indicate abnormal. A negative test result indicate that no late decirculation occur in fetal heart rate. And also, although the fetus was stressed by 3 contraction at least 40 seconds, so it is called, there are no sign of late decirculation. Acceleration is normal. If acceleration is not occur with time, decirculation. There are 3 types of decirculation: early, late, right? So, and also, what are the cause of decirculation? It is important. We should know that. And now select all category question here. So, a Rubella titer, result of 1 day postpartum client is less than 1:8, and the rubella virus vaccine is prescribed to be administered before discharge. So the nurse provides which information to the client about the vaccine? So rubella vaccine we admin to the women who do not have rubella. First of all, this one, and also tell it is good not to get pregnant within 3 months. Very important. So here we are going to explain some basic information about the rubella vaccine. So what it is, the breastfeeding need to stop for 3 months. It is not true. Pregnancy needs to be avoided. It is important. Like mother give a delivery and during the discharge, you give a rubella vaccine. You educate the parents, don't get pregnant within next 3 months. Vaccine is administered by a sub-Q route. Yes, it is true. Exposure to the immunosuppressed individuals need to be avoided. So exposure to immunosuppressed individual. Yeah, it is true. Also, hypersensitivity reaction can occur if the client has an allergy to the eggs. It is true as well. So we have to take a history. Patient do not have any allergic to the eggs. If they have history of allergy to the eggs, we do not give them rubella. The area of the injection needs to be covered with a sterile gauze for 1 week, never ever, right? So our choice is this. So we learn this information about the rubella vaccine. What we learn? Pregnancy needs to be avoided for 3 months. Vaccine administration by sub-Q, rubella gives sub-Q like insulin. Exposure to the immunosuppressed in the individual should avoid it. Hypersensitivity reaction can occur if the client has an allergy to the eggs. So when you take the history and you can found they have an allergy to the egg, it is good not to give them. Here's the rationale. In rationale, actually mentioning same point. Okay, it is good if you start read. Let me read one time. Rubella vaccine is administered to women who have not had a rubella or women who are not serologically immune. The vaccine may admin to immediately postpartum period to prevent possibility of contracting rubella in future pregnancies. The live attenuated rubella virus is not communicable with breast milk. So baby are allowed to drink the breast milk. And breastfeeding does not need to be stopped, right? So another question is here, what in this question? So the nurse is here a clinic is instructing a pregnant client how to perform the kick count, how to perform the baby's kick count in the mother's abdomen. Which statement by the client indicate need further instruction? So which statement your patient telling wrong and you need to correct them, right? About the kick. I will count the number of movement or kick. I will count. So need to the further. So further means something wrong, need to correct. I will record the number of movement. Is good, you could. I need to lie flat on my bed to perform the procedure. They does not need to lie, but they say I need to lie flat. If I count fewer than 10 cake in 2-hour period, I should count the cake again over the next 2 hours, right? If I count fewer than 10 cakes in 2-hour period, I should count the cake again over the next 2 hours. I should place my hand on the largest part of my abdomen and concentrate on the fetus movement to the count the kick. It is also true. It is true. It is it. So here option actually this one, I need to lie flat on back. It is absolutely not true. So what are the rationale about this question? Let me read. The client should sit or lie. It is not a big problem. Or lie also on her side to perform the kick count. So lying flat on the back is not necessary to perform this procedure and can cause discomfort and pressure on risks of vena cava, and this is called supine vena cava syndrome or supine hypotension. When they lie down, the uterus is put a pressure on the vena cava, venous return reduce, and patient develop hypotension. So the client is instructed to place her hand on the largest part of the abdomen during the correct countdown to the kick and concentrate on the fetal movement. The client record the number of movement felt during a specified time of period. The client needs to notify the healthcare provider if felt fewer than 10 kicks over two consecutive 2 hours, right? If less than two. But here showing in this question, if I count fewer than 10 in 2-hour period, I should count the kick again over the next two. So what is the correct? They said the client needs to notify healthcare provider if she feel fewer than 10 kicks over the consecutive 2 hours period.